Tell us more about the vaccination situation in South Africa after the AstraZeneca jab rollout has been temporarily halted.
We haven't actually started using vaccine in South Africa. We had ordered 1 million doses from SII, and that arrived approximately a week ago. And we were due to start deploying that vaccine over the next couple of weeks. We need to vaccinate 1.2 million healthcare workers, and obviously we would require more than the 1 million dose that we are currently have available to us. The big problem, of course, is that we're using the AstraZeneca vaccine, and that does not appear to be particularly effective against the South African variant, although it really isn't the South African variant because it's now been found in more than 40 countries. But it's not as effective against this 501YV2, which is the variant that we find predominantly in this country at the moment. 21% efficacy in terms of preventing mild or moderate disease, but we don't yet know how efficacious it is in terms of preventing hospitalization or preventing severe disease. So that is what we are waiting for, is that data. We expect that it wouldn't be that different from the J&J or Johnson & Johnson vaccine in that similar technology has been used. And the Johnson & Johnson vaccine has about an 85% efficacy against severe disease. So we are still awaiting that data in terms of the degree of protection offered to people, and particularly in terms of mortality. But that is obviously related both to severe disease and hospitalization.
How are the South African authorities looking at AstraZeneca's claim that it believes its vaccine can protect against severe disease?
So we don't yet have that data. It certainly was efficacious in terms of preventing severe disease when looking at the original variety of COVID-19, the so-called vanilla variant, in other words, the original one. So it is very effective in preventing severe disease. We don't yet have the data with regard to the degree of efficacy against severe disease with regard to our variant, which is the 501YV2. That data should be coming out in the next week or so.
WION now available in your country. Download the app now. Get all the news on the move.